Hello, everybody. It's Dr. Duncan from Siskiyou Medicine. I'm joined by Ron Veitel and Dr. Sonja Halsey, and we're having a great time again here at Siskiyou Medicine in Medford. We're a direct primary care clinic where we provide unrestricted access to primary care, naturopathic primary care, I have to add. And we had a health question submitted last week, and I'm going to turn it over to Dr. Halsey.
Yeah, so last week we had someone after the show ask about women's health exams, the annual exam. Are they healthy? Are they necessary? Are they harmful? So I thought we'd start off tonight just giving a little more information on the three aspects of the women's health exam and when we actually need to get them. So the first part is what we all hear of as the PAP, and that's the cervical cancer screen. So that's when, a speculum's put in the vagina and you actually take cells off the cervix. So that has recently changed in the last couple of years, the requirements. Right now, if you're age 21 to 65, it's once every 3 years if you have normal exams. Now, if you come back with an abnormal exam, which means they're finding atypical cells on your cervix, then you're going to talk to your doctor about the next steps of what you need to do and when you need to get screened. So then the next part of the exam is the pelvic exam. And that used to be an annual thing that would happen, kind of with the PAP. But they're actually finding that there's no benefit of having a pelvic exam unless you're symptomatic. So really, you just have one when you get your PAP. You don't need to have one every year. And then the third part, which I think is one of the most important things to do more regularly, is the breast exam. So self-breast exam should be done as often as you can remember to do it, but at least once a month. And then having your doctor do it at least once a year. And more so at age 40 and above, in my opinion. Yeah.
So I read something interesting about that, and that is that women should pick a certain day of the month and stay consistent with that day in terms of like a self-breast exam. Maybe a few days after the start of menstruation. Typically the breasts are a little tender and swollen. They can give you a better idea of what that feels like versus away from hormones, right? Mm-hmm. And then women after the age of 50, I think the breast tissue decreases in density and they become then a candidate for a mammogram. Mm-hmm. So I think to be consistent on that. So women who are no longer menstruating should just pick a day of the month and then stay consistent with that day.
And maybe even doing a physician-led breast exam twice a year.
Absolutely.
And then also, if you're not sure how to do a breast exam, I found a really great pictured procedure on the website breastcancer.org. And then all you need to do is put in the search bar self-breast exam. This 5-step process will come up and you go step by step with it.
Mm-hmm. Excellent. Mm-hmm. Yeah. Nice to be able to take one's health into their own hands.
Very important.
Literally.
Yeah. I didn't even think about it. No pun intended.
No pun intended. That's awesome. So, this has been a topic around the clinic this weekend, and we had a breast thermographer come in and introduce herself. So we'll be offering thermography here at Siskiyou Medicine throughout the year, and that is a process by which a special camera is looking at the heat signature of the body and the surface signature. So it can look at vascularization of the tissues. It can look at if there's extra blood supply or heat. So it looks at blood flow. It looks at potential sites of inflammation, and it penetrates the skin. It penetrates the skin about 5 millimeters. So it's not actually going through you and radiating your organs. It's really looking at what's going on the surface. But what's interesting about that is you get to see these pockets of heat. So in a breast that seems normal with palpation, you can see that there are vascular changes occurring. And oftentimes with breast cancer, you get like a vascularization, right? So you get this extra blood cells that are coming in, and that's what the cancer uses to thrive and survive and thrive. So it's interesting to use a technology like that for a screening tool.
You know, I like what Jody, who is the person coming in to start thermography here, what she said is like thermography is it's a test surrounded by physiology, where mammograms are about structure, and to see structure you have to radiate through the body. So it's just it's a test that's done over time. So you get a baseline, get 2 baselines, your first one, and then 3 months later you do another one. And then it's about looking at the changes over time and the stability of the breast tissue.
I think that's really great, especially in younger females with more dense breasts, you know, and especially if you females out there have dense breasts, it feels sort of ropey, or if you're doing a self-breast exam and you're noticing like lots of lumps, or it feels sort of like knots, you know, maybe a thermography would be a really good option for you versus, you know, going to get a mammogram where you're getting the pinch and the radiation. So, you know, I've had patients that something suspicious will come up with thermography, and then the next step is really to send them an ultrasound to see whether or not. And I think that's what you were talking about in terms of structure, right? So we're looking at the size of the lesion, sort of the content of the lesion, whether it's calcification, borders, that sort of thing that would sort of be mnemonic of breast cancer.
Yeah, I'm glad we brought this up, because I think it's really important for women to know that they have choices out there. I know even though that it's not required to have mammograms with the AFP, a lot of women are starting to get nudged harder and harder to start doing mammograms every year, every other year by the age of 40. Right now, the statistics say that it's still the most beneficial for women that are 50 to 74 to have one every 2 years to detect breast cancer. But just knowing that you have the self-breast exam, you have your physician to help you, and there's other options like thermography and ultrasound.
And I like those options too, the fact that they're not creating a lot of free radical damage and DNA damage with radiology causes, right? So X-rays actually cause. So it's not that I'm anti-mammogram. I think that there's a time and a place for that procedure and that exam. But it's really nice to know that there are options out there that are less damaging to the body and can be as effective. I mean, there was the self-breast exam. We read a statistic today that said that that self-breast exams are better at detecting cancer than mammograms, right? Yep. So there was a study in Canada where they checked 90,000 participants over 25 years.
No small study.
So it's not a small study. This is a lot of people. So when you look at quality of research, you know, 90,000 people over 25 years, that's a huge populace to be tracking. So, you know, those self-breast exams, I think, are really important. So absolutely.
All right, you guys remember breastcancer.org.
Breastcancer.org. Also, I think thermology.com or thermogram.com. You know, look into that information. And know that if you have any questions, you can always call us here at Siskiyou Biomedicine.
I have a question.
Okay.
Is thermography just for women, or can men benefit from thermography?
Well, that's a really good question. And men can also benefit from thermography. And thermography has actually been shown useful to identify other disease processes going on in the body, especially those that can be picked up within that 5 millimeter range. So changes in vasculature, changes in nerve conduction. So it's looking at physiology, right? So you can see different changes. So for instance, I had one done, and, you know, I had a lot of heat coming from my sinuses, and it happens to be that, you know, earlier this week I was having some sinus issues. So it definitely brought that, you know, to the forefront. And so it can be used for more than just looking at breast health, but and men have breast tissue as well. So, you know,
and they get breast cancer as well.
Absolutely. You know, and just with the amount of toxins that we experience in our daily environment and stress that we go through in our lives, you know, it's really important to have that screening tool in place. You know.
Go ahead, Dr. Halsey.
No, go ahead. I was going to almost segue into something I think you wanted to talk about, because we're talking about men and breast cancer and women and breast cancer. And
isn't that amazing? So I was going to segue as Dr. Duncan was speaking about toxins in the environment, one of the things that came to mind for me is something called xenoestrogens. And you may have heard of xenoestrogens. These are man-made chemicals that actually disrupt our natural hormonal mechanisms, really, is how you could look at it, is that they're hormone disruptors. And so one of the things you need to know about xenoestrogens is that when they're in a lot of man-made chemicals, and so they enter into our system, and they can actually build up in our tissue and cause us to become estrogen dominant. And not just women, but men as well. So this is a big issue for cancers such as breast, uterine cancers, as well as prostate cancers, endometriosis. These are all things that can be a result of excess xenoestrogens or artificial estrogens in our environment. So one of the best things you can do is begin to clean up your lifestyle in a way where you're living a more natural lifestyle and avoiding things like soft plastic. So your water bottles that you buy that are soft plastic, that are scrunchy, that you would get like the Dasani or the Dasani, and what are some other
soft
ones?
Plastic.
Soft
You can
plastic.
squeeze it.
You can squeeze it and crunch it. Like your dog loves to chew on it, those things. So you want to avoid those as much as possible. You don't want to, if you do drink out of those, you don't want to allow the water to get hot, like in the sun. You don't want to put it in the refrigerator. So these will leach the xenoestrogens into the water, and you'll drink them and put them into your system. So these are almost ubiquitous right now. They're in almost all commercial cosmetic products. They're in our food supply in the form of pesticides, herbicides, fungicides. So you want to eat as organic as possible. If you don't eat organic, one of the things I like to tell people is the 80-20 rule. If you can do 80% organic, that's really important. There was a study that was done where they looked at pesticide metabolites in people's urine. Mm-hmm. And what they found was that if you ate organic 80% of the time, that reduced your pesticide metabolites in your urine by 96% within a 1 week period of time.
1 week. Wow, you can clean yourself up quickly.
You can clean yourself up quickly, which is what's amazing about diet. So as far as food is concerned, eating as much organic as possible is really crucial. If you're going to eat something that's not organic, that's conventionally raised with pesticides, you want to make sure that you peel the skin off of it. So something like an apple, you want to de-skin it. You want to clean it really well. There's something called the Clean 15 and the Dirty Dozen. That's something that I would look up. That's the Dirty Dozen are the 12 most pesticide-laden produce items on the market, which consists of things like strawberries and grapes and more your really hard-skinned fruits and vegetables.
Probably those that are more susceptible to pests.
Exactly.
Perhaps. So, one of the things I'd like to touch on with my patients when talking about organics, because organics are expensive. We're going to spend more money, and I think David Sonja talked about that a little bit from Little Sprouts. And when you look at organics, eating the 80 to 20% or the 80% 20% rule, I think is a really good idea. But what I like to say is that if you're gonna eat organic, or if you're gonna not eat organic, at least try and get organic fats. Right. So I think because the fat molecules, and I think that goes back to the point you raised a minute ago where you said that the body accumulates toxins and it accumulates in the tissue. Well, it accumulates in adipose tissue, right? Fat tissue. What are breasts made out of?
There's a lot of adipose there.
A lot of adipose there, and some mammary glands, right? So glandular tissues that have a lot of adipose. And so that's a carbon, right? Adipose are our fat tissues made out of carbon. And it happens to be that a lot of our man-made chemicals are carbon-based or hydrocarbon-based chemicals. So there's that like attracts like sort of scenario. So if you're gaining weight, if you have a lot of weight to lose, or if you have a lot of adipose tissue on the body, then you have the potential to be carrying around a lot more toxins than somebody else that doesn't have that adipose tissue.
Exactly, and it's my understanding as well that weight can also be a manifestation of toxic overload, toxic
Mhm.
burden.
Yeah.
And as we begin to detoxify and get these out of our system, then you can start to lose weight a little easier as
Right.
well. Some weight will naturally start to
I think
shed.
there's a buzzword in the medical community called obesogens. Right. So you have xenoestrogens and you have obesogens that just promote obesity. And that goes back to hormone dysfunction, right? Endocrine dysfunction. So you're looking at insulin insensitivity. You're looking at insulin resistance is another way you put that.
Yeah.
Mm-hmm.
So just the disruption of the hormones, right?
Mm-hmm.
Yeah.
Absolutely. So things that you can do: one, eat as much organic as you possibly can. Avoid animal products that have been conventionally raised with hormones and steroids. So grass-fed beef, wild-caught fish, definitely not farm-raised fish, free-range organic chicken. These are all great options as far as meats are concerned, because these are animals that have not done drugs. You don't want your animals to be doing drugs. And so
this is an egg on drugs.
They look totally different. Trust me, and they actually function. The impact in your physiology is different as well. So eating as much clean food as you possibly can. Avoid plastic products. So the soft plastics. Now, so you can get the dark blue hard plastic water containers, and those are fine. Those are not going. They're BPA free or bisphenol free. So those are things you can look for. But as far as like your traditional water bottles that you buy at a store, you really don't want to use those. Buy a stainless steel or a hydro flask that you can refill just like that with a lid on it, and you can take it anywhere. It saves plastic getting into the environment. You reduce your carbon footprint on the planet. And as well as, you don't want to use things like saran wrap or plastics in a microwave, because that's going to leach those xenoestrogens into your food sources. So household products, your cleaners, you want to use chemical-free cleaners, so use your natural cleaners. And then at cosmetics, this is a really big area for xenoestrogens, is cosmetics. The vast majority of cosmetics that people use, the conventional cosmetics, are highly toxic, and they're not really tested for their safety. And a lot of times when a chemical is tested, it's tested alone and not in combination with other chemicals. And when you begin to combine chemicals, you can increase the toxicity by a magnitude or more. So that's a really significant increase in the toxicity that's going into your system. And you have to remember that what you put on your skin, 60% of what you put on your skin can get absorbed into the bloodstream. It's our largest organ. It's porous. So what goes on the skin can get into the bloodstream, and that can be a major issue. So I always recommend that people use natural cosmetic products, natural deodorants, natural skin cleansers, creams, lotions, all those things. Those can be one major way to eliminate or reduce the amount of xenoestrogens going into your system.
And I would like to say, because I think, especially because when women get breast cancer, they hear the word estrogen positive, so they think there's something wrong with their hormones, and it's not. There's not. They let us be who we are, and since the beginning of human time, we've had them circulate in our body. So know that, and it does have a lot more to do with the environmental stressors and our decreased ability to metabolize estrogen healthily.
Right.
So don't be scared of your estrogen levels, but do the things that are going to help get the estrogen metabolites, metabolizing well, because there's good metabolites and bad. And then when they're done in the body and need to be excreted, that they do get excreted efficiently and they stay out of the body. Mm-hmm. So broccoli, brassicas, eat a lot of them. They have something in them called indole-3 carbinol, and that is so helpful to the liver to process estrogens into healthy metabolites. And then there's our microbiome has a lot to do with keeping metabolized estrogens out of the body and excreted, because they are sent through the bile to the intestines. And there are certain types of little bugs in there that like to cleave this little piece of the metabolite off, and then you just reabsorb it, and then you are in estrogen excess. So having a healthy, diverse diet is really important. Vegetables, healthy meats and healthy fats, as well as you can get help with something called, what is it called? The calcium D-glucarate.
Calcium D-glucarate is a fantastic supplement.
It helps to keep the metabolites in the correct molecule
Configuration.
Thank you. Configuration. Yes. So we excrete them.
Mm-hmm.
That's great.
So with your cruciferous vegetables, that would be all your broccoli, cauliflower, Brussels sprouts, kale. All of these things are fantastic. And if you're not a fan of them, don't worry, because you can actually buy a supplement called I3C or indole-3 carbanols. And you can also get something called DIM, D-I-M, diindolyl methane, which is a metabolite of indole-3 carbinol, as far as I'm aware. And so if you're not a fan of cruciferous vegetables, then you can go to your local health food store or to your local practitioner and get I3C or indole-3 carbinols or DIM, and that's going or calcium D-glucarate, and all those are going to benefit you as far as helping to properly metabolize your estrogen and clear it out of the system.
Yeah. I think I like those supplements and those compounds that help detox and help clear the body of those estrogens. But I think that fiber goes a long way. So it's really important that people eat enough fiber in their diet to then bind the bile salts that you mentioned and get them out of the system. Because when you don't have enough fiber in your diet, what happens is all of those toxins that your liver put into those bile salts get reabsorbed without fiber.
That's right.
Right. So we reabsorb about 95% of the bile salts that we express out of the bile, out of the gallbladder. So if you're not eating enough fiber in your diet, then you're just perpetually, reabsorbing those toxins that your liver's detoxing you from.
Right.
And it's not like you were exposed acutely and then you go out and you're in a clean world. It just happens to be that you're exposed to hundreds of thousands of chemicals that are released into our environment. I did a talk on glyphosate, herbicides, pesticides, fungicides, and it's really incredible the amount of chemicals that are put into our environment without even human testing, right, to see if they're healthy for us. And I think that's a problem in the United States, at least. I think Europe's a little bit better. They do testing before they're allowed to put something into the environment. But that's something just to be aware of, that industry doesn't have your best interest at heart, really. So it's best to really do the research for yourself.
There's been over 80,000 man-made chemicals released into the environment since World War II. And you have to imagine that you're like a rain barrel. If you know what a rain barrel is, as it rains, it stores the water, right? And it builds up and it builds up. And eventually, if there's too much water, it's just going to spill out. Well, you're like a walking rain barrel with toxic exposure. So as these xenoestrogens or other man-made synthetic chemicals are coming into your system, they build up in your tissue. And if you're not doing anything to facilitate getting them out of the system, they're going to build up and build up and build up and build up. And one day there may be one exposure too many. Mm-hmm. And you're going to get a cascade of effects that come from that. Things like environmental chemical sensitivity or multiple chemical sensitivity, or what is also known as sick building syndrome. Mm-hmm. You've heard of these. So these are where people become so toxic that their systems begin shutting down. They're become super sensitive. This is a real issue. So we want to make sure that you, one, minimize your exposure to these chemicals, and two, facilitate the elimination out of them. And in regards to fiber, I'm really glad you brought that up, because most of us Americans are not getting enough fiber in our diet. So we want to shoot for about 30 grams of fiber a day, which is actually easier than it sounds. If you eat copious amounts of vegetables, and a serving of vegetables isn't really that much.
9 to 12 servings.
9 to 12 servings. A serving, that may sound really overwhelming at first, right? 9 to 12 servings. Yeah. People would go, oh my God, that's incredible, right? But you have to realize that a serving of spinach is 1 cup, whether you cook it or eat it raw. So think about how much 1 cup of spinach is packed in, and then cook it down, and it becomes like...
It's like a forkful.
It's like a forkful, exactly. Yeah. So, servings aren't as much as we may think they are. Broccoli, it's like half a cup. So you can get a lot of servings of vegetables in really much easier than you think you can. So shoot for eating, what I tell people, 50 50% of your plate in vegetables, whether they be cooked, raw, fermented, it doesn't matter. 50% of your plate in vegetables.
Mm-hmm. I really like what you said about, we're being exposed to a lot of chemicals in our environment. I think 80,000, right? And it leads to things like multiple chemical sensitivity. And we started off talking about like women's health and breast health and vaginal exams. And I think to go back to that, just to sort of, the ultimate is getting cancer or getting something that's going to ultimately end your life quickly, right? We're all going to die. I mean, there's like this thing, right? But to know that I have this diagnosis of breast cancer and oh my goodness, I have this 5-year survival. I mean, the whole scare around it. But even before that, your system can give you clues as to what your hormones are doing, like your skin, right? I think one of the biggest things, like you talked about putting things on your skin. But looking at things like acne or eczema, certain rashes on your body, your energy, what's your thyroid doing? How do you, energy? Talking about energy and metabolism, are you gaining weight? So I think it's really important to pay attention to how you feel and what's going on, and looking at, what's the quality of my skin look like. But looking at, and even in talking to your provider and doing a hormone test, getting the breast exam done, doing your doing the yearly exam, or is it twice a year or every 3-year exam?
Every 3 years, unless you've had abnormals, and then that's discussed with your doctor.
Right. Yeah. So I think that's super important. I have I do have patients that come in for skin issues, and we oftentimes will look at xenoestrogens, looking at liver function, and then how do we get them out of this estrogen dominance? So I see that a lot, is this estrogen dominant piece, and you might be able to speak to that more than I.
The estrogen dominance? Yeah, it's so the estrogen dominance, low progesterone picture is usually 2 very painful periods, heavy bleeding, and long periods. That's a big one, especially because that's when you look at that picture, it does fall in the line of fibroids, endometriosis, PCOS. So.
And is also I just got to throw this in there because this is an American epidemic, and that is stress. That chronic day in, day out stress can cause a reduction in our progesterone, because that's the raw material for our cortisol, the hormone that helps us handle this stress. And if we aren't if we're not managing our stress, if we're not doing something to reduce our stressful burden, then the progesterone levels can drop, and that will lead us to estrogen dominance as well, in combination with all the toxins that are in our environment. So we're really facing a lot of issues that our ancestors, 100 years ago, were not facing today.
And also wanted to just hit on estrogen dominance in men. You'll see a level of estrogen come up in men, and it oftentimes leads to hyperplasia of the prostate, so an enlargement of the prostate. You also see a conversion of testosterone to DHT, or dihydrotestosterone, which is very inflammatory to the body. So men can experience this as well. So if you out there who have joined us or watch this at a later date, if you know anybody with an enlarged prostate, or having difficulty initiating urine stream, or dribbling, or incomplete voiding, then consider having hormones tested, looking at a PSA, and then also looking at estrogen and testosterone levels, because men are susceptible to this as well, especially men who drink a lot of beer. So there's a phytoestrogen, right? We've got it at xenoestrogens, but what are phytoestrogens? So men should really be cognizant of the fact that they're at risk for estrogen dominance as well.
Absolutely, it's not just a female condition.
No,
right? We have estrogen too.
No, and with the use of so many hormones in our medical system now, and in our population, there are a lot of hormones that are being released into our water supply and our fish, our oceans, right? So
I actually just had a patient decide to switch from topical estrogen progesterone cream to something called a troche. It's sublingual. Because, and I thought maybe she was reacting to it, and that was her reasoning. And then when I called her back, it's because she's, around her grandchildren all the time. She's like, I don't want them to be exposed to this. And we don't think about those things too, what put on our own bodies.
Our water is a wonderful source of medications, unfortunately.
Yeah, unfortunately.
So if you're drinking tap water, please make sure you're filtering it first, and you have a really high quality filter.
I personally like the Berkey filter. Not that I'm getting paid by Berkey or anything, but
I
kind of like the Berkey system.
I like the disclosure.
Well, you guys, I think we're out of time.
But I know. Oh my God, it's a half hour.
All right, so we're gonna wrap up
6:30.
tonight. Thank you for joining us again. We're Siskiyou Biomedicine in Medford, Oregon, and we love getting questions from you guys. So please submit any pressing health questions you might have, or if you know somebody that's struggling with a health condition and you're just curious or you want to help them out, go ahead and submit those questions to admin, ADMIN, at SiskiyouBiomedicine.com, and just title it Wednesday Night Live. So that way we know that it's a question pertaining to the Wednesday Night Live sessions that we're having, and that we can address those questions. Thanks for joining us, and we will see you next Wednesday.
See you next
Bye, guys.
Wednesday.
Bye.
Bye-bye.